I will say this is getting tough. Staying home, not being in school, it's getting really old for all of us. And I'm asking you to hang in there with me just a little bit longer. It's still a critical time these next couple of weeks, and I know it's brutal. But I will tell you, I have spent the last 24 hours meeting after meeting focused nearly exclusively on how do we safely get folks back to work, child care centers open, et cetera. So I don't have an answer, and it's not going to happen in a week or 2 weeks, but I want you to know I have my eye on that prize and making sure we can do it safely. And in the meantime, hang in there a little bit longer, but just know that I'm right there with you and know that this is getting harder, not easier. But we can do it. We can do it, and if we hang tough together, we'll all be safer and better for it. Tomorrow, by the way, we will be back to the 1 o'clock time. I'm sorry we had to switch to 2:30 today, but tomorrow we will be back at the regular 1 o'clock hour and continue with 1 o'clock from there on. So I want to begin today with a little bit of a change in how I'll be giving these briefings. Usually I begin every day with just the facts, the number of people in the hospital, number of people who have contracted the virus, et cetera. You will see today on the screen a new dashboard that my team has created, and from today going forward, in every one of these press events, we will have that dashboard on the screen. It will be updated daily so that you can see the information that we have as it relates to coronavirus. I have to say, I want to give a huge shout out and thank you to the folks on my team who have made this possible. It might look simple. It's just a simple snapshot of all the data. There's a ton of work that went into that. I am so proud of you all for making this possible. From day one, I have said I wanted to be transparent and fact-based. I want to give you, the people of Rhode Island, the facts that you need and deserve to live your lives safely. And so this is just another step in our effort to make the information that much better, more accessible and more granular for everybody to see. The snapshot is just the basic data. If you go to the Department of Health's website, under the section of data, you'll see a little bit more. So there's a breakdown there by city, cases by city. There's a little bit more information if you're interested for a little bit more information. So again, thank you so much to everybody on the team who worked so hard to make that possible. And I hope Rhode Islanders will feel a little relief when you look at that. I mean, the numbers are going up, and that's not a great feeling. But on the other hand, it's there. It's the facts. And from the beginning, we've said facts, not frenzy. And so I'm trying to do our part to make sure you have those good facts. I wanted to take a minute today to provide an update on our work stream around quarantine and isolation. So yesterday I gave a little bit of an update on testing, and each day I want to give you a view into the work that we're doing. Why is quarantine and isolation so important? Because when we get to a point where people start to go to work, kids start to go to school, the way we're going to be able to do that safely is if we can quickly identify who's sick or who has been exposed to someone who's sick, and then quickly get them into quarantine, or if they are sick, isolate them. That's the name of the game, to have a more pinpointed, focused way, instead of what we're doing now, which is this blunt instrument of, closing all restaurants and having social distancing, which is something we can't maintain. The group that runs we call it QI, Quarantine and Isolation Work Stream, is the fabulous Rose Jones. Rose is our Director of Office of Healthy Aging. She has a team of a few dozen people reporting to her, and her job is to make sure that we have enough quarantine and isolation facilities and rooms and that everybody who's in quarantine and isolation is properly supported so that they can adhere to the requirement of staying home, which is not easy. Not easy. Someone has to do your grocery shopping, go to the pharmacy, check in on you, track your symptoms, etc. So over the last 6 weeks, Rose and her team of about 60 people, which is a cross-sector team, it's people from the Health Department, our Office of Planning, Housing Advocates, National Guard, tech team, and more. They've built an entire system from scratch. We had none of this a few weeks ago. At this point, we have more than 6,000 Rhode Islanders in quarantine, the vast, vast majority, nearly all of whom are safely in their homes. And as a quick reminder, quarantine means staying home. It's a fancy word for don't leave your house, not even to get groceries. In order to help those people in quarantine, we've developed the capability to deliver tens of thousands of meals per day and also deliver thousands of grocery deliveries per day. Again, a few weeks ago, we had none of this capacity. So over the last month, Meals on Wheels made 32,000 home deliveries, while our senior centers and schools are also distributing 22,000 meals every day. When I made the tough decision to close schools, I knew that for most kids, a lot of kids, the only way they're going to get a meal or two a day is at school. And we committed ourselves then to making sure we would get this nutritious food to children, and by and large, we've done that. By the way, thank you to Meals on Wheels, thank you to the mayors, thank you to senior centers, thank you to all of our municipal leaders. We are the mission control, my team and I are the mission control, but we have so many partners on the ground, and as it relates to food delivery, huge shout out to municipal leaders because you've been terrific partners. This week, the numbers continue to grow. You know, tens of thousands is going to go up. So I'm pleased to announce that now the URI Dining Services is launching a partnership with senior centers, delivering healthy dinners to our older neighbors all around the state. So big thank you to URI for being a partner and doing your part to help us through these difficult times. Now, again, as I've said, when the coronavirus is tough on everybody. Unfortunately, it's toughest on those who are already vulnerable. If before coronavirus you were living in poverty, you were housing insecure, you had a difficult domestic situation, this has only made it that much worse. And it is my commitment to do everything I can do every day to make sure that nobody gets left behind. Now, I will be the first to say we are far from perfect, far, far, far from perfect. We get a little bit better every day, but man, we have a long way to go. And there's lots of people out there who are really struggling, still homeless, still struggling. Kids who are still having a hard time with access to Wi-Fi. But I'll tell you this, we're going to fight every day to reach every last one of you. And literally every day we're getting more of you. More kids today have access to Wi-Fi than yesterday, literally. More people who are homeless, struggling with the virus, we're reaching them more today than yesterday, and we're going to stay at it. So to that end, for those people who don't have a safe home in which to quarantine, we've contracted with the Wyndham Hotel in Warwick. It currently has just over 200 beds reserved for people who are homeless or housing insecure. And we've served about 50 people already at that location. So again, if you're homeless or housing insecure, or you just lost your job and become homeless, we still want to keep you safe. And so we have arranged for this hotel so that we can keep you there safely in quarantine. I also know that being in quarantine can be incredibly lonely. Sitting at home or in a hotel alone for weeks on end. And this is particularly so for older Rhode Islanders. So the working group that Rose runs, in collaboration with community partners, has developed programs in which people can check in on one another every day with a daily phone call or a daily Zoom call. We have well over 100 volunteers already signed up to check in daily on our older neighbors through Project Hello. So that's incredible. Like, just, I know this is hard, and as I say, everything I roll out is imperfect. 3 weeks ago, we had no infrastructure for quarantining and isolation. Now we've commandeered a hotel. We have 6,000 people in quarantining. We're delivering 50,000 meals a day, and we have Project Hello with over 100 volunteers checking in on our seniors to make sure that they don't get lonely while they're in quarantine. So to the team who's been making this happen, thank you. Thank you, thank you, thank you. And to everyone in Rhode Island, know that we're going to stay at it. Having said that, I want to give you a preview of what is to come, because we are going to keep working 24/7 to make this support more robust. We are working on robust delivery and concierge service to ensure everyone has the food and supplies that they need. So I've recently reached out to Uber and Lyft to see if we could do a partnership with them to enhance our ability to deliver groceries and food. I know we're not meeting the demand, so we're going to do more. We're working with our colleges and universities to discuss the possibility of using some of their dormitories to provide free housing to people who need it while they're in quarantine. You know, for example, if you're a frontline worker, if you're a healthcare worker, and healthcare workers are truly bearing the brunt of this, or a first responder, you might not want to go home at night because you don't want to expose those living in your home to the virus. So we're looking into using dormitories as a safe place for you to live without cost to help you get through the stretch. We're also working on a one-stop app, a phone app or computer app that allows real-time tracking and monitoring of symptoms so that when you're home, if you're sick, you can have a constant check-in on your health condition. All of this is necessary to take care of Rhode Island, but also I have to have it all in place at scale before I can reopen the economy. So that, to give you a view of how we're thinking about it. I also want to make an announcement today that something we've been working very hard on is the launch of a new initiative called rihavens.com. It's a new website that connects those in need of a safe space to quarantine with hotel rooms across the state, hotel rooms offered at significantly reduced prices. If you go on to rihavens.com, you will find very affordable options as low as $25 a night. And this is part of the broader effort that I'm describing. If you are a frontline healthcare worker, if for whatever, your first responder, whatever reason, you don't feel it's safe to live in your house, you don't want to expose others in your home to what you've been exposed to, you can go to rihavens.com starting today, and there's a variety of options there for hotels, a variety of price ranges starting at $25 an hour. Soon, I hope to have more options there which will be free in the dormitories that I was just describing. I want to give a huge shout out to the Rhode Island Hospitality Association and all of the local hotel owners and operators. You guys have been terrific in partnering with us and helping us to help Rhode Islanders stay safe. So my priority is to make sure we're all safe. And again, once we get to the business of letting more people go back to work, we need to have more of these quarantine and isolation services up and running. And so that's our goal. But I've heard from a lot of you, I especially hear from healthcare workers. I think it's unbelievable what you're doing, fighting the fight every day. And the least we can do is make sure that you have a safe place to go home at night and keep yourself safe, or quarantine and isolate if you need to. So I hope some of this gives you some sense of relief. And again, I hope that by this time next week, I have even have even more options to share. Speaking of frontline healthcare workers, I would like to take a second to talk about PPE, personal protective equipment. Yesterday, I was asked a question by a reporter. The question was, are the hospitals all set? Do they have enough PPE that they need? And what I said is that essentially they do for now. They're getting through, they're getting by a day at a time, a week at a time. We're not in a position, which is where I'd like to be, where they would have several weeks of PPE on hand and where they would have clear visibility into how much they could procure. As a result, many of these hospitals are having to make really tough decisions. And that means if you're a doctor, if you're a nurse, if you're working in an ER, if you're a CNA, if you're a social worker, if you're a behavioral health care worker, you're living under really tough conditions. You're having to reuse your PPE, maybe reuse it to a point that you don't feel comfortable. You're having to have your PPE used and cleaned and reused. You're having to put it in a paper bag. Let me be crystal clear. That is not satisfactory. That is not what we're trying to achieve. That's where we are today. And I just today, in fact, I had a phone call with Steve King, who's managing the state's PPE inventory. We're getting more masks. We are struggling to get gowns. That's a difficult thing right now for whatever reason. We are placed a huge order for surgical masks. We are trying to get our hands on as many N95s as we can. It is a fight. It is continually a global, daily fight out there, and we're out there and we're doing it. So, are we managing? Yes. Are we getting by day to day? Yes. Is it the crisis that it was a couple of weeks ago? No. But do I think that if you're a doctor or a nurse or a CNA, that you're all set and things are great? Absolutely not. And I want you to know, I value your courage and your bravery, and thank God we have you, and know that we get up every day to do better. And we will continue to do better. We're getting the Battelle system soon, which allows us to sanitize masks at tens of thousands at a time. We're getting more orders in. So we're going to get you there. Hang in there, continue to be brave, keep saving Rhode Islanders' lives, and stay in touch with us and the Department of Health so that we never get you into a situation which is back to that crisis. I neglected to mention something on the quarantine and isolation, so I'd like to go back to it. Yesterday or the day before, there was a question around, what if you live on a border town to Massachusetts and want to go grocery shopping? Barrington, Tiverton, lots of folks in the East Bay live right on the border. It's frankly easier and quicker to go to Seekonk to do your grocery shopping. The question was, I think, do we have to be in quarantine? So, look, let me tell you what I think about that. I need you to be smart about it. If you live 5 minutes away from the Stop and Shop in Seekonk, and it's a half an hour for you to get to the next Stop and Shop, well, then go to the Stop and Shop in Seekonk. However, when you come home, stay in your house. Remember, everybody's under the stay-at-home order until May 8th. So all I can tell you is, and I can tell everybody out there, the less you leave your house, the safer we'll all be. In a fantasy world, which is not possible, if we all stayed in our house for a few weeks, we could probably get this thing down to 0 infection rate. We can't do that. I'm not suggesting that. My point is, just use some good judgment. I don't want you driving 30, 40 minutes to do your grocery shopping. But if you have to go to Seekonk, Attleboro, if that's the best, safest option in your judgment, go ahead and do that. Come home and stay home. Wear your mask when you're out. Wash your hands constantly. Go alone, don't bring your whole family, stay away from people in the grocery store, and don't go out if you're sick. So all of these measures that we're offering are intended to keep you safe and keep your neighbors safe, and frankly, to make it so we can all get back to work more quickly. So I wanted to address that, and I hope it helps. Back to healthcare workers, we're working very, very, very hard to make it so that our frontline healthcare workers can get tested more quickly. And right now, we're focused on all healthcare workers, but most particularly those folks in nursing homes and in other congregate care settings. So if you're a nurse or a physician or a CNA, and you are working in a nursing home, in a group home, in another congregate setting, we are very, very focused on making sure that you can all be tested immediately, without delay, and get your results quickly. And I expect to have more announcements around this today, tomorrow, and the next day. The announcement for today is that I want you to know we've set up a fast-track testing system available for all of our nursing home healthcare workers through the CVS site at Twin River. So we spoke yesterday with CVS. CVS is phenomenal. I cannot say enough good things about the corporate partner that CVS has been. They're going to give us a couple hundred spots every day just for frontline healthcare workers in congregate settings. So you won't need an appointment. These will go quickly. You'll get your result right away. So nursing homes, if you're a nurse and you're hearing me say this, you want to know how you get it, talk to your boss at the nursing home. The Department of Health is in touch with all the nursing homes, and they're making arrangements for everybody to get this test as necessary. We're going to continue to roll out other fast-track ways for all other healthcare workers in the coming days. And one other point, it's actually ending on kind of a sweet note and a happy note. Obviously, having to be home is very difficult. But maybe even more, certainly even more difficult is we now have a lot of people who are sick in the hospital, sick in isolation, and it's incredibly difficult because their family members can't visit them. It's devastating, really, if someone you love, your husband, your wife, your mother, is in a hospital or in a setting and they're sick and they're suffering and you can't be with them. So we've been trying to figure out how can we ease that pain a little bit so that people in isolation in hospitals, have some human contact with those that they love. And we've, been putting out the word that we want some help with this. So a 19-year-old Providence resident, Kaya Sooner, heard us talking about this issue and immediately looked for a way to help. He partnered with the Rhode Island Medical Society to create an initiative called COVID Connectors. And it's a program that allows anyone to donate iPads, iPhones, and laptops to Rhode Island hospitals. And today, I'm very proud to say that Amazon has generously agreed to donate 540 tablets to support this effort. So this is a fantastic thing. I would ask you, if you have an old iPad or a tablet or a phone and you are in a position to be able to donate it, please go to covidconnectors.org, covidconnectors.org. You can turn in your device. They'll make sure to wipe it clean, or even better, you could do that before you submit it. And then that will be available to somebody in a hospital or in a nursing home or congregate care setting so that they can stay in touch with their loved ones. We've done it. My son Tommy has given away one of his iPads because he wanted to do his part. I'm proud of that. And if you can, I would urge you to do it, because it's not only our physical health, but it's our mental and emotional health. And now's the time to pitch in and be there for your loved ones. So Kaya, you're 19, but you're a superstar, and you're a hero, and thanks for stepping up.